Good morning, everybody, and welcome to this AI event, COVID-19, a food supply crisis or a hunger crisis. My name is Vincent Smith, and I serve as director of the American Enterprise Institute's Agricultural Studies program, as well as a professor at Montana State University. This morning, it is my privilege to serve as moderator for this event, and before we begin, I'd just like to deal with one housekeeping issue and then introduce the panelists. Hopefully the discussion will raise lots of questions. To send the panel your questions, either use the hashtag AEI COVID Hunger Webinar or email your questions to philip.hoxie, that's phillip.hoxie @aei.org. And now I'd like to introduce the panelists. And I'm going to introduce them in the order in which they'll be speaking. Dr. Joseph Glauber is a senior research fellow at the International Food Policy Research Institute and a visiting scholar at the American Enterprise Institute. He previously spent more than 30 years at the US Department of Agriculture, where he served as the department's chief economist until his retirement from USDA in 2015. His current research focused heavily on domestic and international agricultural policy, and in the current moment on the impact of the COVID-19 pandemic on food production and distribution. Our second panelist is Dr. Dianne Schanzenbach. She is the director of the Institute for Policy Research and the Margaret Walker Alexander Professor in the School of Education and Social Policy at Northwestern University. She's also a research associate at the National Bureau of Economic Research. The importance of her work on early childhood education and major public policies such as the SNAP program has been recognized at the highest levels of academia through her recent election to the National Academy of Education. Dr. Angela Rachidi is the Rose Scholar in Poverty Studies at the American Enterprise Institute, where she examines poverty and the effects of federal safety net programs on low-income people in America. Her research focuses on the relationship between employment and poverty, and specifically on the effectiveness of government programs and policies on increasing employment and family well-being. Our fourth panelist is Dr. Scott Winship. Scott is the executive director of the Joint Economic Committee of Congress. And before taking his current position, Dr. Winship held positions at the Manhattan Institute, the Brookings Institute, and the Pew Charitable Trust, where his research examined the impacts of welfare reform, including the 1996 initiative on poverty and well-being. His current focus is heavily on policy and social capital and family well-being. As the title of this event indicates, our distinguished panel of experts will examine and discuss two major questions. The first is whether or not the United States is facing a food shortage crisis. Some commenters have suggested that we are. Some have even suggested we may need rationing for various products. Others are less concerned about the availability of food through the US food production and distribution supply chain. Although some supply chain interruptions seem likely, well, in fact, are occurring. The second question involves food security. And whether or not there is a hunger crisis in the COVID-19 pandemic situation we find ourselves. It is tempting to believe that if there is no major food supply issue, then there is no hunger or food insecurity problem. But that has not been the case in the United States or many other rich countries over the past 60 years. Food plenty and food insecurity continue to coexist, even when the economy is doing well. And right now, the economy is not doing well. By almost any measure, the unemployment rate has increased from about 3.6% in February of this year to over 20% right now. Almost everyone has an extended family member or close friend who has lost their job, and the impacts have been substantial for many households. Further, as in the two most recent severe recessions in the early 1980s and in the 2009 to 2011 Great Recession, The burden of unemployment falls most heavily on low-income minority communities and young people aged 16 to 20. In both 1982 and 2010, when the overall unemployment rate was about 9.6%, unemployment among young people exceeded 23%. And among the two largest minority groups, African Americans and Hispanics, ranged from 12 to 19%, much higher levels than the average. In that context, as almost everyone now recognizes, food insecurity, hunger, and even malnutrition are concerns for the communities that we live in and that we have to address. Low-income families also spend much more of their income on food, but buy less food. On average, American families spend less than 9% of their income on food in the home and away from home, around $8,000 in 2018. Low-income families, families in the lowest 20% of the income distribution, spend over 35% of their income on food, around about $4,000 a year. In his opening comments, our first panelist, Dr. Joseph Glauber, will focus on whether or not there is a food supply crisis. Dr. Dianne Schanzenbach, Dr. Angela Rachidi, and Dr. Scott Winship will then address how hunger is being and should be addressed through nutrition policies like SNAP and school lunch initiatives, income safety net programs, and public-private philanthropy partnerships like the food banks. With that brief introduction, let me now turn the podium, as it were, over to Dr. Glauber for his insights.
Great, thanks very much, Vince. Yeah, so my section here is I'm going to talk more about on the farm side and what's going on in terms of the overall agricultural system. We have had a lot of disruptions over the last few weeks, certainly, and I'm just going to go through them very, very briefly. I think it's important to remember that agriculture actually has had a fairly rocky 2 years. First with the trade wars with a whole host of countries, including China being the most prominent, but also Mexico and Canada, the EU, which resulted in some pretty significant drop in exports and market prices for farmers. And in general, farm income would have been far, far lower had it not been for the fact that the government paid out a massive $28 billion over the last couple of years in terms of supplemental payments. These were payments on top of the price and income support programs, on top of the federal crop insurance program. And if you look at farm income numbers over the last couple of years, farm income or the farm payments have been a very, very large portion of those total income. Well, with the impact of COVID-19, you've seen two major impacts. One is the direct impact on health in terms of how it's affected farm laborers, how it's affected the meat processing industry, which has been quite significant with many of the plants losing capacity because workers have been ill and haven't been able to essentially, the plants have had to close. We've been anywhere between 30% and almost 40% of hog processing capacity has been out. One of the largest plants, Smithfield, just went back online today. But this has been a very fluid situation and has been very, very disruptive. The other thing is the impacts of the containment policies themselves. The fact that people aren't able to send their kids to school, the fact that you can't go to a restaurant has meant that all that food, which about 50% of food expenditures are consumed away from home, all of that essentially stopped, or most of it stopped. And so not only are people having to go to the grocery store a lot more, the fact is a lot of the food that was destined for food service industries is in very different form than what you find on the grocery shelves. So we've had a very big disruption there. And the consequence of all of this has been higher prices. What I think we'll see some higher prices at the retail store, particularly because of what's going on in the food processing side. The fact that we'll see short term at least higher prices there. That will have a bigger impact on, as Vince mentioned, the fact that poor people spend much more of their income on food. That will have a bigger impact there than on more affluent families, certainly. But then the other thing is, as any sort of cost that hits in the middle of the marketing chain, a lot of the instance of that also falls on producers. So we've seen very, very low prices. And if you look at since the first of January, prices for most of the commodities have fallen significantly and have been off 10 to 15%. And if you look at what that meant for income, a recent estimate by the Food and Agricultural Policy Research Institute out of Missouri, noted that crop prices down 5 to 10%, livestock prices down 12, 15% or so. That means that receipts are down significantly. They project down almost $30 billion, which is quite a lot. And some of those losses are offset by the standing disaster programs. But more importantly, they saw before this CARES Act, which just was passed a couple of weeks ago, came through, they were projecting farm income down about 20 billion. And that analysis didn't really take into account the disruptions we're seeing in the meat processing industry. It was mainly through a loss or a drop in corn prices due to the fact that ethanol consumption is going down because people aren't driving. And in any event, the Congress did react, passed a $2 trillion package. Of that, about 19 billion has been the USDA has said that it will be going out with, and that will go out to farmers over the next few months to compensate for losses that were incurred essentially last quarter or the first quarter of this year plus the next 2 quarters. And there's an additional 14 some odd billion dollars that could be then put back in. So I think for the farm income side, if you look just on the farm side, that the compensations will probably cover the losses. The problem is we'll do it imperfectly. Some will get overcompensated. Some probably won't get compensated far too little. I think the bigger impact, however, will be what emerges out of this recession, how deep it is, and how long it is before the recovery happens. Because one thing which is true about the farm household income is that 90% of it or so comes from off-farm sources. I think people oftentimes forget this, that the farm income side is important, but most of farm income comes from off-farm sources. So if we have a prolonged recession, particularly in rural areas, this could have some impacts. I think the supply chain disruptions are really what are in the news right now and are quite significant, and are affecting all of us in terms of what we're seeing in grocery stores and other things. I think these will be short run, just in the sense that presuming that COVID-19 will ultimately figure out how to put in biosafety protocols and other sorts of things. And it could be for at least one of the costs of this in the short term is higher prices. But again, there's no question there's ample food. It's just a question of getting into consumers. And I think that will be more of a short run issue. The longer run issue, though, I think is a recession. And I think it'll be a lot what people are going to be talking about in the next few minutes. So I will stop there, Vince. Thanks.
Well, thank you. Thanks, Joe. I'm going to turn to Dianne Schanzenbach now. Dr. Schanzenbach, you have the stage, as it were.
Thank you very much. So thanks for setting this up so nicely. Of course, we're facing this double whammy of having the health crisis along with the economic crisis, and then the two interacting. Just wanted to underscore that 30 million workers filed for unemployment insurance over the last 6 weeks, nearly 10 times the worst period that we faced during the Great Recession. This Congressional Budget Office predicts that the unemployment rate might be raised above 10% for the next 18 months. So we are going to see a recession here like we haven't seen, certainly in my lifetime, maybe not even in Vince's.
Thank you so much.
But something that we know well from our studies of prior recession is that low-income folks lose their jobs first, although in this case, everybody lost their jobs at the same time, but they recover more slowly. It took fully a decade to regain the jobs that were lost during the Great Recession. So last week we got our first, I think, systematic glimpse at how households are coping with the COVID crisis. This came from the COVID impact survey that was jointly fielded from the Minneapolis Fed and another organization that I forget right now. But what we learned from that is that food insecurity rates have tripled. 42% of families with kids reported that they were worried that their food would run out, not because of supply chain problems, but because they didn't have enough money to buy more. 28% of families overall reported food insecurity. Of course, this whole crisis is being made worse because kids are missing their school meals, which are usually the front line of defense against childhood hunger. Our safety net, just hasn't been prepared for something this quick, and we're struggling to respond. Of course, at the same time that states are needing to work to protect their own frontline workers, move to telework, et cetera. I think that the states are doing, the best that they can, but we've been struggling to keep up with things. So Congress and the Department of Agriculture, I would say, have implemented smart and temporary fixes, like extending the current SNAP caseload so they don't have to go in to recertify right now, and streamlining some benefits calculations. They also made some smart, what I hope will be permanent fixes, such as telephonic signatures for applications and allowing SNAP participants to use their benefits to purchase online. They've also had some slow responses on some aspects. For example, there were relatively slow approvals of cash payments that Congress authorized to replace missing school meals. That's called the PEBT program. I think we're up to 11 states now have been authorized to provide those payments. Those are really important because not everyone who gets free or reduced price meals at school is also on SNAP. And so there's sort of a large number of kids who are falling through the cracks. And while school districts, went to heroic efforts to stand up meal, feeding sites, there were all sorts of problems with those. Participation was low, in part because people are being told to stay home, and so it doesn't make sense to go out. So I think that's good policy, and it's we'd like to see it sort of move out more quickly, this PEBT program. So back to the COVID impact study, we've learned that as of 2 weeks ago, about 14% of households have applied for or received SNAP, and about 8% have gone to a food pantry for food support. Of course, I want to pivot and talk a little bit more about SNAP. SNAP is really important when it comes to making sure that families have adequate resources to buy the foods that they need. And it's a really important tool in times of recession because these are paid out as monthly benefits. So families have access to them quickly, and they can, under normal circumstances, apply for SNAP and receive benefits quickly. SNAP is well designed. It meets needs that families have to buy groceries, and it also stimulates the economy, which is going to be something that we need, as we move out of the acute public health crisis in the coming weeks or months or however long it takes, and move to sort of the economic recovery. So to my mind, an increase in benefits will be a very important aspect of the recovery. During the Great Recession, Congress increased benefits by 15%. And that was quite effective last time, both in terms of protecting families from food insecurity, but also stimulating the economy. As Joe suggested, we might, if prices go up, we might actually need more here. And just the extent of the recession here also suggests to me that we might 15% might be the sort of lower bar that we need for this. And of course, there's a limit to how much you can do through SNAP. I would love to see us continue to protect children. Like I mentioned, 42% of households with children reported food insecurity in April. So I'd love to see us extend this cash benefits in lieu of school meals, the PEBT program. It's really unfortunately named PEBT. Extend that through the summer, potentially add a young child multiplier onto SNAP to make sure that children are getting enough food or at least have enough resources to buy food. We know that there are long-term negative outcomes from kids at particular ages not having access to adequate food. It's very important that we do our best in this time of acute recession to protect kids. So this is sort of the last point that I wanted to make before turning it over to the other panelists is we primarily have a work-based safety net in the United States, and that has many advantages in good economic times. So we have the earned income tax credit, SNAP, increasing fractions of people on SNAP are also working. But what we learned during the Great Recession is that there are big holes in that safety net when we're experiencing economic downturn. So we do also need to be thinking about other ways to boost cash resources to low-income families. Now, we think that some of the changes in unemployment insurance that were done through the CARES Act will help some families that are experiencing food insecurity and also on SNAP. But there are many people that are falling through the cracks, immigrants, homeless. Certainly, I think we should be talking about extending some emergency TANF funds, which haven't been done, to provide cash assistance to families, like I said, who are falling through the cracks of the safety net. One final word, to be sure, right now is a terrible time to be enforcing work requirements on programs like SNAP and Medicaid. And I know that those were temporarily suspended, but my one concern that I have is that people will want to bring those back too quickly after the acute crisis is gone. Like I said, the economy is going to take much longer to recover, even after we, have the stay-at-home orders lifted and so on. So we should be extremely concerned about food insecurity right now, and the fact that we have a fragmented safety net that is only imperfectly responding.
Thank you, Dianne. For some perspectives on the effectiveness of other safety net programs beyond the food-oriented programs, let's turn to Dr. Rachidi.
Thank you,
The floor
Vince.
is yours, Dr. Rachidi.
Yes, thank you. And thank you, Vince, for putting this panel together, and to my colleagues for providing your insight as well. So yes, as Vince said, I'm going to talk a little bit about some of the other income programs that are available to help families get through this crisis. So Dianne touched a little bit on some of the data, but just to provide context, so in typical times, so before this crisis, in any given year, there's roughly about 12 to maybe 15% of households on surveys that indicate they're food insecure. And so what that means is it doesn't necessarily mean hunger in the sense that they cut back on food because of income, but it does mean that they have indicated on a survey that they worry about where food is going to come from, that they struggle to afford the types of foods they think are most nutritious for their family and things like that. So certainly families or households that struggle to afford food. And then we have about, again, this is in a typical year, about 5% of households that have what we call very low food insecurity. And those are the households that do actually cut back on food because they can't afford food. Fortunately, in the US, children are largely protected from the very low food security, but we do still have about 5% of households that suffer from very low food security. So you can imagine in a crisis like this with such high unemployment, that those families are particularly vulnerable, but then you also have all of these other families that due to job loss also become vulnerable and might fall into that group. So the most vulnerable, given the current crisis, are obviously low-income families who don't have access to savings, credit, things like that, that can kind of weather the job loss that they're experiencing, get them through that time before they can either get employment again, or they can get access to other supports. So those are our typical low-income families. According to a Pew survey, I think that was put out a few weeks ago, about 55% of low-income families had reported some sort of job loss or reduced hours, which just shows you that those already vulnerable families in typical times are even more vulnerable right now. And I think we've all heard the statistics about the percentage of families that don't have savings and things that they can access during a crisis. I think some of those data are a little bit unclear, but it's anywhere from about 20% to 40% of households say that they don't have access to cash or other means to get them through a crisis. So the government does provide some programs beyond SNAP that I think can be very useful to families during this time. I mean, one Dianne mentioned, which is unemployment insurance. And I think we've all kind of seen the news, and we know that that's really on the top of people's minds in terms of the expanded unemployment insurance that provides $600 per week in additional unemployment insurance benefits on top of what workers or former workers would have gotten already. There also were some other expansions in unemployment insurance for people who wouldn't typically be eligible for unemployment insurance. And that's like gig workers, part-time workers, and low-income workers tend to fall into that category. So as part of the CARES Act, some of these low-income households that wouldn't normally get unemployment insurance hopefully got access to unemployment insurance. And that should help them through this crisis in terms of helping them to afford food. I think some of the concern obviously around UI is just the ability to access it quickly. States are dealing with unprecedented number of claims and just old systems and the ability to get those checks to people. And that just creates some food security issues for those families, again, that wouldn't have the resources to kind of get them through that period. The other kind of main income transfer program, which is actually a relatively small program compared to some of the other programs in terms of like SNAP and EITC and things like that, but it is TANF, and Dianne mentioned that. So again, in typical times, TANF is primarily for low-income families who are not working, low-income families with children. Mostly single mother households with children receive TANF, although low-income married couples are eligible as well. And so this also can serve as a resource during this time for unemployed families who have faced unemployment. The thing with TANF, there's kind of two competing forces, I think, going on with TANF right now. On one hand, TANF is actually, it's a little bit easier to get in the sense that all the requirements that are typically a part of TANF in terms of work requirements, requirements to do activities, have been eliminated across the states. And so families do not have to really satisfy any of those requirements in order to be eligible. But on the other hand, the expansion of unemployment insurance may make TANF less necessary for certain families if they get access to that unemployment insurance. But either way, certainly TANF can serve as a resource to low-income families during this crisis and to help them with their food needs. The other main program is the Earned Income Tax Credit, which really is it's kind of the second largest anti-poverty program in terms of dollars that go to low-income families. Unfortunately, it's not effective at all in this crisis because the Earned Income Tax Credit is only provided once per year to low-income families as a cash transfer, but it's only provided at tax time. And I think that is it's our main tool for fighting poverty, but it's really not, well, obviously a completely ineffective tool during this period to address food needs of low-income families. I think there's some things that Congress could consider in terms of the Earned Income Tax Credit, such as doing an emergency EITC or doing a supplement like the supplement or the stimulus that was provided earlier. But so far, Congress has not done that. So those are kind of, I think, the main cash transfer programs for low-income families. There's also a number of other opportunities for low-income families, like even the PPP, the small business loans. So if you have like childcare providers, which tend to be low-income families that might run their own family daycare out of their home, they would be eligible for PPP funds. And so I think that there are a number of opportunities for low-income families to get access to resources to help them through this time. The critical point is, however, how these programs are being implemented and how much access these families are actually getting to these programs. We know from some survey data that some of these families do not seem to be accessing all the programs that they may be eligible for. And some of that is just the slow nature of how these programs get implemented. And some of that is because states really are largely have the responsibility for administering many of these programs. and states have just been bombarded with families coming to them who are in need. And so I think it's understandable to give states a little bit of leeway in terms of implementing these programs. I just wanted to end with a couple of thoughts, maybe some concerns I have in how low-income families are weathering the crisis in terms of their food needs. One is related to SNAP. I mean, obviously, I think Congress did a really good job in trying to address all the needs that there were for SNAP. There's some concerns, though, how low-income families might have access to food. So obviously, many of us have turned to maybe online shopping. I think that's much more difficult for low-income families. And especially if they're going to use their SNAP benefits. There are some opportunities for households to use SNAP benefits to online shop, but it's somewhat limited by state and also limited by connectivity for those families. And I think obviously families also have less access to credit cards and credit and things like that, and just some of the concerns that I have around how they are actually shopping and getting access to food. And then finally, I'll just mention, I mean, Dianne covered SNAP pretty well, but in terms of really, so like I said, Congress did a good job, I think, in addressing the needs of low-income families through SNAP. But again, it's an issue of implementation. So it is very concerning that only 11 or whatever it is states have done the pandemic EBT, which is to provide additional SNAP resources into families with school-age children. I hope that states are able to do that at a much greater extent. And then the other is Congress passed an emergency allotment for SNAP, which basically allows states to bring all SNAP households up to the maximum benefit. And almost all states, I think it's about 42 or 45 states have implemented that, but I've heard that it's been rather slow in actually getting those dollars into households. And so I think it requires all of us and policymakers in particular, and really figuring out what are some of those implementation challenges and really helping states get over those hurdles.
Angela, thank you. So now I'm going to turn, last but definitively not least, to Dr. Winship for his insights and thoughts on the issues that have been raised in the discussion.
Well, thanks, Vince, and it's a pleasure to be on the panel with such great folks. I should say up front that nothing that I say should be construed as reflecting the views of anyone on the Joint Economic Committee or Senator Lee, who I work for. These are all my own thoughts personally. So I think that thinking about this as a crisis, or at least a potential crisis, it's not clear that we yet have a food supply crisis or a hunger crisis. We want to make sure we avoid those things. Thinking about it as a crisis is important and useful for distinguishing where we've been from where we are, and for distinguishing the sorts of policies that I think we ought to pursue. So I think it's really important to acknowledge up front, just reiterating what Dianne said about the unprecedented nature of kind of what we're up against in terms of the unemployment figures, and if we end up seeing similar unprecedented levels of poverty or hunger, that would be a real tragedy. Fortunately, I don't think that we will, but nevertheless, it's important not to be complacent about that. So where we've been, on the other hand, I think is a little bit better than what's commonly understood. I think a problem with the word crisis is that it's used too much, and so when it's actually appropriate to use, as is currently the case, it loses its weight, because a lot of people have been saying for a long time that we've had sort of a poverty crisis or whatever. And I think it's just important to understand that on the eve of the pandemic, things were a lot better than most people think. Poverty was almost certainly at an all-time low by any reasonable definition of poverty, which the official poverty rate would not count under that. But the Center on Budget and Policy Priorities, for instance, said as early as 2016 that child poverty was at an all-time low. The food insecurity data that's out there, the U.S. Department of Agriculture maintains the best set of numbers that's there. And the last report they put out was for 2018. At that point, 11% of Americans were food insecure. that compared to in 2001, which is the first year that's comparable, it was 11% in 2001. So no change over time. That conclusion holds if you look at households with kids. It holds if you look at female-headed households with kids. It holds if you look at very low food insecurity. So not big declines in food problems by any stretch, but not any increases either. And in 2019 and early 2020, that was probably those numbers were probably even a little bit better. There are a number of reasons for that. We probably don't want to get into them on this panel. There were periods of strong economic growth. There were certainly SNAP expansions, especially in 2008, 2009. There were other safety net expansions, some good, some not so great. And there was welfare reform, which in my view and the view of a bunch of others, actually did serve to reduce poverty over this period as well. All of that said, even in 2018, over a third of poor households were food insecure, according to the USDA measure. A quarter of African American families with kids were food insecure. So there were reasons to be concerned about food insecurity prior to the current pandemic, for sure. But if we're talking about crises, if Diane's numbers, which may or may not be directly comparable to these numbers I'm citing, on food insecurity are true, we're looking at like a doubling of food insecurity already, which, as Angela points out, may have more to do with anxiety than with actual hunger. But nevertheless, that's a dramatic increase in a very short period of time that we'd want to be concerned about. Okay, all of that to bring back the point about thinking in terms of crises and how that ought to affect the way we think about policy. In the in the Great Recession, if you look at comprehensive poverty measures, it turns out we did a pretty good job of preventing poverty from skyrocketing during that period. It actually increased by quite a bit less than it had in the early 1990s recession, for instance, the early 1980s recessions. So anti-poverty policy has gotten better over time at responding to recessions. And I think that it's on track to do that this time. Angela went through a bunch of the UI provisions that have already been passed. SNAP, there's been some important initiatives passed as well. But here I also want to point out the distinction between policies that people wanted before we entered an actual crisis and policies that are appropriate now that we are on the verge of a crisis. Because I think that there are some ideas being thrown around that don't necessarily make a ton of sense. It makes sense to me that in a massive recession, that we would want more people to have access to the SNAP program, for instance. It doesn't make more sense to me necessarily that people who are receiving SNAP benefits ought to get a lot more in benefits than they did in the past. And I think there are a lot of arguments being thrown around by folks on the center left along the lines of we need to expand the maximum benefits available to SNAP families without really explaining why that is something that is appropriate for this particular crisis. One explanation that I think is really compelling that I've not heard enough of, I think, is this issue of kids not being able to access school nutrition programs because of the school closures and the stay-at-home orders. The PEBT program that Diane and Angela both mentioned, I think is a really important policy change. And that's the sort of argument where you can say something has changed versus the way the world was 2 months ago, and it necessitates some kind of policy change. I think that would be a really important way to go. On work requirements, what we did in the Great Recession, I think, was appropriate, giving states the ability to waive work requirements if they meet conditions that are tied to the emergency unemployment compensation benefits that were available. Something like that makes a lot of sense now, I think. But it is important to remember too that we're really only talking about 7 or 8% of the population when we're talking about SNAP beneficiaries who are actually subject to work requirements. So far, I think the policy response has been pretty good. I think the crisis has exposed potentially an issue that merits a lot of thinking over the longer term about policy, which is whether it's a good idea or not, or what the pros and cons are of delivering lunches and breakfasts to kids via our educational institutions. You can imagine other policies that could be effective that would involve more generous SNAP benefits, for instance, or something like that. But clearly that's a way in which kind of a little bit of a strange kludge in terms of our previous policies has really been problematic for the crisis. So hopefully those are some useful thoughts, and look forward to any questions in the Q&A.
Well, thanks, Scott. There's a lot to chew on here. I've got a, when I listened to Scott and I listened to Dianne, are you guys on the same page with respect to the amount of SNAP benefits that are being offered or should be offered?
So, in listening to the conversation, I think that there's, many areas of agreement, but as far as I can tell, a place of disagreement between Scott and Angela and me is, I think, moving into the recovery of this, are we going to need to stimulate the economy? And so, of course, one reason why, as Scott said, the folks on the center left, like me, have been, so keen on increasing SNAP benefits, both maximum benefits by 15% or so, and then doubling minimum benefits, is because of what we learned during the Great Recession about how effective it was at stimulating the economy. Now, it might feel premature to be thinking about stimulating the economy because we are still in the midst of the public health crisis, but we're going to turn to that very quickly. And so I think the time is now, or sort of when we can pass the next response bill to set that up, especially if, as Joe suggests, we're going to see food inflation that's going to continue to necessitate higher SNAP. So I think that's one place, I don't know if Scott agrees with me, that my take is that Scott thinks we don't need to stimulate the economy yet.
Scott?
I agree with that, and I think I'm pretty skeptical about whether we'll need to stimulate the economy at all. Certainly, if there were major food inflation, maybe that would change my mind. But this is a very different. It's a government-created, policy-created recession that I support the creation of the recession for the public health reasons, but the underlying fundamentals of the economy were quite strong prior to that, and there's going to be a lot of pent-up demand, I think, from folks who are staying in place and who are not going out and spending money. And so I think in that sense, it will be very different than the Great Recession, which really did involve this huge shortfall in demand. So I think that's my own take on sort of how a lot of policymakers have thought about the current recession that we've entered into is that it has been confusing for a lot of people because we typically don't intentionally enter into recessions for public health reasons. And so a lot of the kind of go-to policies for left and right, I think, tax cuts, on the right, for instance, to stimulate the economy, like that's just the wrong way to think about the current recession that we're in.
And I just have to go on record that I could not disagree more. When the Congressional Budget Office has said that we're expecting to have elevated rates of unemployment above 10% for the next 18 months, that does suggest to me that we'll be in a recession that requires stimulus.
Just a quick comment. I mean, the evidence from previous recessions, and I went back to look at the '82 recession in particular, as well as the Great Recession, because they were about equally deep. Even in 1982, when recovery was viewed as very quick, it still was about an 18-month recovery period. The Great Recession took a little bit longer for us to get back on track. Scott, which of those two stories, though, do you think is more realistic? The quickest recovery from a deep recession, 10% unemployment, we have seen in the last 60 years was in between 1981 and 1984. And it took about 2 years. Why would we believe that this will be a better story?
So I guess I would distinguish between a quick recovery versus a long recession. I do think we're probably likely to be in a quite long recession, and I wouldn't challenge the CBO estimates at all. But I think that is mostly going to be because of the public health issue. If we either stay in place for a long time or we stop staying in place and there are new spikes in coronavirus deaths or cases, COVID-19 deaths or cases, and we have a series of kind of rolling peaks where people get afraid to go out in the economy and spend. I think that unfortunately is quite likely unless we develop some sort of treatment or ultimately a vaccine or implement some sort of mass testing program. So I think I agree with Dianne that we're likely to have a long recession. I just would disagree about the extent to which stimulus during that period is going to have much of an impact, or maybe even be advisable in some cases until the public health crisis is figured out.
Before we turn to questions from the audience, I have one last question for all of you. You have not mentioned food banks, nor have you mentioned the policies that the government is implementing with respect to giving food banks more resources and whether those policies make sense or not. Joe, what do you think about the food bank programs that we have seen in the CARES Act, in the most recent legislation, the $2 trillion legislation?
Well, there's a lot of money for food banks. I mean, I think part of the problem with food banks always is, they often, have been tied to strings where, they get what food they can get, and oftentimes it's surplus commodities and things like that. And I think food bank managers would love to have the ability to people actually want to eat and what food they, can. But you take a lot of it's donations and other sorts of things. And I mean, I think that right now, and again, I tell you so much of this problem because we don't have good data yet. So much of it's anecdotal, and so you look around at what's going on, and I've been over at food banks working for the last few weeks, and you can just see this sort of food that comes in, and some of it's good, and some of it's people are trying their best to kind of put together boxes, but they're in high demand right now, and there's no question with the spike in unemployment and and just trying to get people, even in food banks, they're trying to social distance, and that cuts down on line speed and other sorts of things. So it's a challenge, but I think that certainly it's a welcome sign that some of this money was out of the CARES Act was put towards food banks. So we'll see.
And Vince,
Angela, let me go to Angela and then to Dianne.
Yeah, well, I just wanted to add, I think that the additional money was very important, and I think these programs do serve a very important need because a number of families do not want to necessarily access SNAP for a variety of reasons, or they may not be eligible. They might kind of just be above the income eligibility requirement, or they just don't want to open up their financial records to the government agency. So I think there's a number of families who do not want to access SNAP, where these types of food banks can kind of serve that short-term need that hopefully will be solved in the long term by UI or something else, but it can be very important for that short-term need. And also covering the groups that Dianne mentioned in terms of immigrants, all these other populations that just can't really access SNAP, for example.
Dianne.
Yeah, if I could also, I guess I've seen some numbers that seems like nationwide demand at food banks is up 50% in the short term. So that's a very large spike. my concern is how long will we have to sustain this, this acute response, especially as children are out of school. And something that I had not appreciated until this event was how much of food bank food comes from donations from grocery stores. And for example, places like Starbucks, where they'll donate at the end of the day some of their prepared foods that they're not going to keep out for the next day. And so many of those have dried up. I know here in Chicago, we've seen just a massive response by people donating money to food banks, and that has just been greatly heartening. It sort of makes us all feel like Americans in this together. But as we shift toward sort of the longer rebuilding from this, I would love, Joe, if you've got more things to say about smart policies that USDA, and others can implement, in particular, because I think so many of us are seeing these visuals of people, flushing milk down the drain and letting potatoes rot in fields while there are miles long lines at food banks. And we think, what's going on here? Is there a good way to solve it?
Scott, what's your view?
I guess
I'm sure you do have a view.
No, I'm actually mostly curious about Joe's answer to the question Dianne just asked.
Well, let me turn to Joe then. Sorry, Scott, I'm not trying to put you. Joe.
Yeah, no, I think there's been some real efforts at looking at how to get food to these food banks. I mean, you see what's been going on from restaurants and all this food service food that is having difficulties finding a home. I think people are trying to get those to food banks, and in my own experience, that's where in sorting some of the food and everything, that's where it was coming from, was things from Amazon or from Whole Foods and some of the other big distributors that had stuff. But Dianne raises this issue about where we have seen, say, in Florida, where people are this is a shoulder season when most of the produce that is grown in Florida comes to market. They're having a hard time. Not there's some labor issues, but it's mainly the fact that so much of it would go into school lunch programs, or some of it would go into food service restaurant foods. So cucumbers going for pickles and things. I mean, just odd things that you don't think about. And unfortunately, because they're so perishable, it's hard to get that to market. So it's not a question where you just say, well, okay, we'll send some people out there and try to get it. But that's in fact what people are trying to do. They're trying to glean what they can. And and maybe some lessons are learned from this that we can apply later on from this. But I think unfortunately in the short run, I mean, not to make too much of a joke of crying over spilt milk, but the fact is, I think a lot of those things have happened, and that hopefully we'll get some of the supply chain back. And I do think that the people trying to transform some of this food that's going into the food service, which would normally go to the food service industry, which are in huge cans, they're in big cuts. They're being broken up, and I've seen all sorts of creative things that are being done there. But again, this is largely anecdotal, and I think the real issue is that what Dianne mentioned is you have a 50% increase, and so it's a huge demand to be met right now.
Let me just ask one last question in this area. Does it make any sense for USDA to be trying to transfer commodities? Is it better for the federal government simply to write checks to the food banks to allow them to meet the local needs in the ways they see best at this point? Is that the federal role?
I would say yes. I think here's a real need, and that I think these food banks are really the ones who should be, in a normal time, should be the ones making decisions on what to purchase and other sorts of things. The problem is these aren't normal times, and so you can't just have a food bank start showing up at the same grocery store everyone else is, because it's it's just contributing to the shortages that we are seeing. And they're true shortages. You think about shifting 50% of your food expenditures away from home all of a sudden to grocery stores. People are really having a hard time keeping up with the inventories and trying to keep stores stocked. And it's classic behavior when you see that you can't get flour this time around. The next time you see 2 bags, you'll grab 2 bags. And I think that will take a little while before all this stuff gets sorted out. Now, I don't know what the federal role on the other hand would be. I think any sort of regulatory hangups. And clearly, you still have to maintain food safety. You don't want just people slaughtering animals and things like that in a back store somewhere. I mean, you need inspectors and all that sort of thing. But I think that any sort of thing that is hanging up, trying to transfer, produce and things like that to food banks, I think, should be that is a role the federal government could play to try to get rid of those sorts of things or suspend them in the short run for this.
Well, I want to turn to some of the questions that we've had come in, and I want to remind people who are listening in, the audience, that there are 2 ways to submit questions. One is to use the hashtag approach. That is hashtag capital A, capital E, capital I, capital C, OVID, capital H, UNGER, capital W, EBINAR. So that's hashtag AEI COVID Hunger Webinar, or send your questions to Philip Hoxie at aei.org via email. That is PHILLIP.HOXIE@aei.org. There have been a couple of questions that have come in, and there's a very interesting question, which is a Joe question. So I'm going to apologize to the other people on the panel for a moment. Jerry Hagstrom is asking Joe whether or not we can help food supply by prohibiting the exports of hogs and pork products.
Yeah, I think that would be a real mistake, and I think anything that's dealing with trade restrictions, you see it on the other side too. I've seen some efforts to convince the president or others to impose restrictions on imports so as not to compete with farmers. I think trade protections are only going to exacerbate problems. We've seen this abroad with some countries putting on bans on grain exports. Thankfully, they haven't been anywhere near the level that we saw in 2007-8, and it looks like most people now are taking those bans off, which is a really good sign. But I think to do that would just penalize the livestock industry even more, and they're really getting hurt right now. But to really cut off markets, and I think really the concentration should be on getting putting the biosafety protocols in place so you can get people to work, and if that means slowing down line speeds or whatever, but to get these plants up and operating again in a safe way. Because unless you treat them, and you can take the Defense Production Act and say you got to get back to work, but unless you can really satisfy the safety requirements, I think that's going to be a big challenge. And I think the underlying issue is really the one that needs to be met. And I don't think you should get around it by slapping on export bans and other things. We've seen that in medical goods, and I think that's a very, very bad sign.
So I have a question now for Dianne Schanzenbach. Dianne, the question is, in your assessment, is the safety net adequate to assure that there will not be significant problems, particularly for children, over the next 5, 10, even 50 years?
Oh, not at all. To be sure, I want to highlight that even though Congress has made some steps, I think that the steps right now are inadequate. So a few things I want to make sure to note. Although there were these large expansions in unemployment insurance, we still estimate that only a minority of people, let's say on SNAP or people experiencing food insecurity, will be eligible for unemployment insurance because of a number of reasons that we can get into another time. According to the COVID impact study, only 2% of families have either received or applied for TANF. There have been no additional funds released there.
Oh, by the way, let me interrupt for a minute.
Sorry.
Can you define for the general audience what TANF is?
Sure. This was what replaced the cash welfare system when we ended welfare as we know it. In the old days, welfare worked sort of like SNAP, that it would automatically expand when need was larger. In 1996, they block granted it to states. And so, states have basically the same amount of money that they did in 1996 to address poverty. As part of the Great Recession, they expanded that a little bit. That certainly helped. We have not seen that happen yet here, and I think that's badly needed. But even then, I think TANF is a very small program that definitely needs additional funds. Another thing I wanted to clear up is that PBT is not SNAP. It is a different program, PEBT, this money that goes to families that are missing their school meals. And so that doesn't get to count as something that Congress has done with SNAP. So to be sure, I think we will see in this recession, like we saw in the last recession, that many families with children and adults will fall through holes in the safety net because of the safety net that we've designed. That works. We don't need to argue about whether it works in good economic times, but right now we're in bad economic times, and a work-based safety net then has large holes. We can do things to address this. To be sure, expansions in SNAP is high on my priority list. Other forms of cash assistance to the vulnerable in this time of economic downturn are also high on my list. But without question, I think we will be doing permanent and irrevocable damage to children if we do not step up.
There's a question for Joe, but I'm going to, Christopher Banks sent us a question about whether or not the president's executive order in relation to packing plants, meat packing plants, where animals are slaughtered and processed, will have any significant effect on the supply of meat, and whether or not it's a wise program in general. Can you talk to the supply of meat? I know you've already addressed this to some extent, Joe.
Yeah, I know. I think so. You have, many of these plants are really hot spots in their state. I mean, I think the Smithfield plant at one time was accounting for more than half of the COVID-19 cases. So these are real hot spots. You have people working in close proximity. You have, what I've been told are really favorable environmental conditions. That is, you're in a really cool environment with a lot of humidity. And you have people working in close proximity, and in a lot of cases living in close proximity. So many of these people share apartments. They may be get together socially. Oftentimes they, if they're maybe same ethnic background, and so there's a lot of real concerns about addressing the underlying disease, and to say, okay, well, we're going to put in some. I think some attempts are made to go into these things to try to get people spaced out a little bit more. All that means lowers line speeds, and so you're processing less meat, but at least you're processing some if these are actually able to are really able to keep the COVID incidence of COVID down and stop the transmission. But I think until that confidence come back, I think it's going to be very, very difficult to get labor willing to come into those plants, and so I think that's going to be a big issue. And this isn't something you just say, well, here's someone off the street, give them a knife and let them start cutting. I mean, these are, you know, skilled jobs for what they for these positions. So I think that it's going to take a little bit of time again to see the confidence. We had the plant in Greeley went up back online last weekend, I guess, right before the weekend.
Plant, right?
What's that?
That's the big plant in Colorado, the green.
Right. Yeah, that's right. And then they had another recurrence. And so I think that, you know, again, these are going to be things that people are looking at and trying to, you know, it's not just a question of doing a big deep clean and then say, come on back in. I think people are going to have confidence that this is going to work. So hopefully it will.
Scott, one of the big issues is, but for school children in particular, one of the big issues is what about the summer and what about access to food? What are your insights there about current policy and what may or may not need to be done?
Well, so there, I think the crisis is probably the wrong way to think about the problem of kids having breakfast and lunches in the summer that they would get at school during the school year, because that's true of every summer that we have. It does certainly, you know, if you thought that our policy in that regard was bad before the crisis, then certainly, you know, it's still bad. And you know, there are policies that you could imagine along the lines of, I don't know, expanding SNAP benefits seasonally or something like that to deal with that. But it doesn't feel like we've been able to address that problem even during normal times. You know, there is a very small summer nutrition program through USDA that serves a fraction of the population that usually gets school lunches or even school breakfasts. But to the extent that's a problem, it's not something that I think has become worse as a result of the pandemic. But
it's a big problem.
It's a gap in the safety net for sure. I think but it's not a pandemic related gap in the safety net.
Can I insert on this? We know that every summer when school is out, food insecurity among children spikes. And I think, to be sure, we'll expect that to happen again this summer, but now probably from a higher baseline, because we've seen, you know, this doubling or tripling of measures of food insecurity. I think that it might be worse this summer because, to the extent that the stay-at-home orders are still in place, I think we'll see just increased uncertainty of low-income families' economic situations in ways that we don't normally see. So I would expect this to be worse. And of course, I think that because we've got the PEBT system set up, because there's concerns about will we go back to school in the fall, it makes a ton of sense to continue the PEBT programs across the summer and then pivot to the fall if that's what we need to do.
Yeah, I would agree with that. I think I'll want to see what the USDA food insecurity figures are to compare against their own figures to see if we've really seen a doubling or tripling. And even if we have seen a doubling or tripling, that could be, as Angela said, around anxiety and things like that, rather than hunger per se. But I agree the PEBD benefits are important.
Angela, what's your perspective here?
Well, I do think the PEBT can be very helpful this summer. I think for most of the country, the stay-at-home orders will be largely relaxed by the summer, maybe not in certain parts of the East Coast and maybe other areas, but I think for much of the middle of the country, you're going to have that. So hopefully people will start to go back to work, but that doesn't mean that this low-income population isn't still going to be vulnerable. And I think that Scott's right that that was a gap that was already there. And I think Diane's also right that the baseline is going to be higher. I think my bigger concern is with the PEBT. It does not seem like it's being implemented right now to a great extent. So I think that policymakers at the state and federal level need to figure out how to get that program implemented. Then we can take a look to see if that program is actually meeting the need.
I'm going to switch focus a little bit. We've had two or three questions around the issue of consolidation in the agricultural sector, the move to quote factory farms, juxtaposed with a question that question came from Mary Ahern, juxtaposed with a question about the important, whether or not it's really important that we move to more locally and smaller scale farm operations instead of factory farms. This question came from Barry Stern. This really falls in your bailiwick, Joe. What about the issue of food insecurity in relation to, quote, large scale farming as opposed to smaller scale farming and locally produced foods? And also, what about the impacts, potential impacts there may be on consolidation incentives within the agricultural sector as a result of the current supply chain issues?
Yeah, I think there's no question we're going to come out of all of this with some changes one way or the other. I think that I think these, we've seen the vulnerabilities in the system, and I think that a lot of these meat processors and others are going to work towards, well, how do you improve safety, so you don't get hit with the next big crisis like this. I don't think that necessarily translates to locally produced food. I mean, I think that is a movement that will continue, and that I don't doubt that some people's experience during these quarantines that who are using community-based food operations may continue to do so. Some people may continue to, I think if you look at my Instagram feed, almost everyone is posting pictures of what they ate over the last 6 weeks. And so I think there's a lot of, interest in this sort of thing. But I think by and large, I just don't see the trends that we've seen for the last 20, 30 years in terms of moving towards highly efficient meat processing are necessarily going to be reversed. I don't think so. I think what you will see is efforts made to make these things more biosecure and biosafe.
I had a couple of questions come in that are implicitly asking the following question. Are farmers in trouble with respect to food access, which seems a bit of a paradox to me? And what about the rural populations more generally in terms of access to food and whether or not we should be worried about food insecurity in rural areas? And Joe, I know this is part of your bailiwick. What about the farmer? What about the farming community on average or in general?
Well, I mean, they're consumers, and they're not necessarily going to be eating, if you're talking about a corn soybean producer, it's not like they're going to be eating what they grow on the farm necessarily. I mean, they go to grocery stores and Costco's and Walmart's like everyone else. And so the degree that any sort of there are problems getting food into those areas, I think you're seeing the same sort of issues for those consumers. But yeah, so I think that they're like anyone else in that regard. I don't think they're necessarily, I haven't heard at least or read of any problems particular to rural areas. But I do think, back to my point in my opening comments, off-farm income is just so important for farm households. I mean, even those who are making the majority of their income off or on the farm, that is from farming enterprises, a lot of that family income still comes from off-farm sources. And to the degree that a recession may hit rural industries, or the fact that you look at I early in my career did surveys in small farms in Wisconsin, and it was surprising how many spouses and other things drove school buses or worked in things that are all shut down now. So I presume that they're being affected just like everyone else. And to the extent that they're covered under other CARES Act provisions, I think is really important for those families. But long term, the recovery is going to be equally important for farm households, just like it is for anyone else.
And that's because so much of their income, 80% on average of the reported taxable income, comes from other places.
Right. That's exactly right. Right.
Yeah. I have a really intriguing question that's getting a little bit in the weeds. USDA is planning to introduce a food box plan to deliver, to use commercial distributors to deliver household-sized boxes of meat, produce, and milk around the country. Is this a practical approach? This question, by the way, came from Philip Brasher.
Yeah, I don't know. Others may want to comment on this as well. I mean, I think certainly if you, I'm going to distinguish it a bit from the harvest box proposal or whatever was made a little earlier, because I think this, if some of this is getting at some of the gleaning aspects, then I think, great if you can do that. But yeah, I think that, again, I look at it from big picture and think it's inefficient. I mean, it's just not something you necessarily want to. I mean, it's a little akin, and I'm probably opening up a huge can of worms here, but talking about when we talk about foreign aid, shipping that on U.S. bottoms and that sort of thing, you're just adding all these costs that could be used towards addressing the real issue. Now, don't get me wrong. I think in these particular times, anything sort of things that can both help farmers by or getting produce that's not being consumed and is just being destroyed. If you can get that in the hands of families that need it, great. More power to you. But I suspect there are more efficient ways of doing these things, certainly long term.
And I would add to that, probably the more efficient way to do this is to direct those commodities to the food banks that are already on the ground doing this work. They already have a system where they put together boxes. The response that we've seen here in Chicago by the Food Depository, maybe you've seen pictures, there are boxes all over the United Center floor, and we're, pushing them out to families in need, all the time. Like, that is how the government should be responding. They should be buying these commodities, not packaging it themselves, but making sure that they get to the local food banks that can then get them out to their neighborhoods, just like they do year in and year out. They are responding to this crisis. They need more supply coming their way.
So Scott, I want to put you a little bit on the spot, and I apologize for doing that. One of the tenets of economics is whatever the goal that we have, that goal should be accomplished in the most efficient way. Do you have concerns that with respect to creating the food safety net, to some extent, we're sort of throwing the efficiency baby out with the bathwater, given that we're trying to move so quickly? Are we paying too little attention to efficient policy, to the good use of taxpayer funds?
So is the question, I guess, is in regard to current policy around the pandemic?
Yes, yeah.
So obviously my expertise is not on the sort of supply side issues that Joe knows. On the demand side, I mean, I don't think policymakers have devoted inordinate attention to the food safety net. I think it's been heavily concentrated, and I think appropriately so, on jobless benefits, on the assistance to small businesses, and you can talk about the Fed's efforts for medium-sized businesses as well. I think that's been where most of the effort has been at so far, and I do think that's appropriate. So I don't know. I guess I would disagree with the premise of the question. I think during normal times, and maybe if pushed, I would agree with this even for the current recession. I like the idea of giving people cash rather than giving them benefits that they can only use for specific expenditures. So in general, I think conditional on giving people aid, giving them cash makes a whole lot of sense. But I'm not quite sure that's what the question was getting at.
Well, the food box program, for example,
yeah,
is a program to administer.
Yeah.
And it's sort of a top, it seems to me, and I'm injecting myself in, and I apologize as the moderator, I shouldn't do this, I know, but it seems to me that that's a top-down approach.
Yeah, I'm not a fan of the food box program precisely for that reason that I think Joe articulated pretty well as well. I don't think that is an especially efficient way to. So the most efficient would be give people cash. The next efficient is give them food stamp benefits or SNAP, but sort of picking out a select set of foods that you're going to deliver to them without their having any say over it, or without any regard to whether that's going to be the best thing for them, is definitely a third best of those three options, I think.
I'm going to stay with the SNAP world for a moment. Jerry Hackstrom has sent in a second question. That's a really interesting question. Do we have any knowledge, I think numbers knowledge is what he's looking for, of how delivery fees affect using SNAP online? Joe, do you know anything about that?
I don't. I have no idea. I mean, you can, if I'm not mistaken, yeah, I was going to say this allowance to use other Amazon and places like that. Yeah, I think those are all low costs. I mean, they're charging everything else now for non-essentials, but yeah, I don't. Perhaps one of the other panelists do.
We can certainly get back to him on that question. You know,
well, I know for the few places that allow EBT to be used for Amazon Prime, they have a reduced fee and they waive all of those. Okay. I mean, Prime, you don't pay delivery, so they have a reduced fee on Prime for low-income families that use EBT. But again, that's not very widespread across the country. Right. Prime.
And I think we want to give props to the USDA for having done pilot tests of this, you know, years ago. I think before anybody had any idea that this would be, come to the forefront to need deliveries, quite so quickly. I think the one, criticism that one would have is that then once they did those pilots, moving it to sort of a larger stage has been pretty slow. But they are working to do it now. So,
So the pandemic is giving a real impetus to this initiative. Do you think?
Yes.
The only thing I would say is that if anyone's tried to order online lately, it's not easy. I mean, so take something like Whole Foods, which is essentially in large urban areas and with a pretty affluent consumer thing. But you try getting on there online, you're looking at weeks wait for delivery, even if they allow you. I mean, you have to kind of hit the times where they do allow it. So
there's a timeliness issue.
Yeah.
Does this come back, Joe, to this issue of fundamentally supply chain disruption that we're now looking at?
Yeah, no, absolutely. And I think, again, I think that we're going to come out of this very different. I think people are going to be looking at things, how to improve these sorts of alternative channels, and certainly, again, on the biosafety side, I think you'll see a lot of protocols put in place.
Can I just add too on the delivery? I mean, there's local groceries that obviously do delivery, and I should just add there would be nothing in SNAP or EBT that it would allow those delivery fees to be covered. Right. So Amazon Prime is a separate thing, but yeah, anybody that's using those sort of local delivery from their grocery store would not be covered by SNAP.
So in terms of a policy recommendation, at least short run, would you advocate for that change in the rules?
I don't know. I'm not sure I necessarily would, because you can obviously do pickup. But I think that it's something that should be looked at. And again, I think some of these supply issues and also local groceries are just so busy that it's not timely to get to get food from even the local groceries in terms of delivery. So I'm not sure I would necessarily look to that as being the answer to the problem.
A quick question has come in that says, to what extent does the loss of access to healthcare through loss of job compound the problems that some low-income or many low-income families may be facing in terms of food insecurity? Would anyone like to comment on that question? I'm particularly thinking perhaps, Dianne, you might have some insights there.
Yeah, I certainly my intuition is that is only making it worse. I have not yet seen statistics and numbers to, be able to, hang my hat on that. But, without question, our, tying of health insurance benefits to employment, it has a real downside when it comes to, massive spikes in unemployment. But I think, it'll take more weeks. I guess I'm just not up to the speed on what's happening there.
So I think that losing your job is a qualifying event in terms of being able to enroll in an Obamacare plan. And I'm sure that it's not super easy to lose your job and have to deal with a million other things, and also figure out how to navigate the Obamacare enrollment process as well. But that's a case where maybe the policies are already anticipating a little bit better than what folks might think. But I'm not a healthcare expert either.
I want to ask and go around the panel, and I want to ask the following, and this is a semi wrap-up question. If there were one or two policy changes you would advocate for in the next 2 weeks that Congress should take up and really take seriously, what would those one or two policy initiatives be? And I'll stay with you, Scott.
I'm going to have to largely pass on this one.
I realize you probably do.
I will say I really like the idea of the pandemic EBT to deal with the problem of kids not getting their breakfast and lunches at school.
Angela?
Around the issue of food insecurity, I would do an emergency EITC benefit and do a check to all 2019 EITC recipients, send another one.
That sounds like you're picking up on a targeting issue that we haven't really discussed.
Yes, for
the
sure.
$1,200 per person initiative wasn't.
I really wish that would have been targeted towards low income. I think, speaking of inefficiencies, I think there were a lot of inefficiencies built into that.
What about people who didn't file taxes? Would the proposal that you have work for them too?
Well, no, it wouldn't, and it also wouldn't work for people who didn't work in the previous year. But I think if we're thinking of the most vulnerable population, it's the working population that likely has lost work, and it's low income, and those are the EITC recipients. I mean, we know about a third of tax filing households receive the EITC, so that's a pretty large group.
And more precisely targeted than sort of a mass mail out of checks.
Exactly.
Joe, what about yourself?
Yeah, I mean, I to me, the food security issues are the biggest, and but turning over to the ag side, I mean, I think, to me, the biggest thing right now is this problem with processors, meat processing, and that really needs to be addressed very quickly. I don't think you need legislation to do that, by the way. I think what you do need, these guys are going to have to get access to, PPE equipment and other sorts of things, and have to be. What's that?
Testing.
Yeah, I mean, certainly that would be great. I mean, it's hard when you're talking about a limited number of tests and with a lot of needs right now. I mean, we don't even have a very good notion of what the incidence really is, and we know who is ill, but that sort of thing. But testing, yeah, I mean, I think these plants really need to be, as much efforts put there to try to get them back and to
And ensure workers are safe.
right, exactly.
Dianne, you get the last word.
Great, I've got my two. The first is this PEBT program. 50 states should have it. It should be expanded through the summer. I would even note that Angela's great idea of injecting more cash to low-income families with kids through the EITC could be done through the PEBT program. It's targeted, it's efficient, it's effective, and it should be expanded. The second, of course, is we should increase SNAP benefits by at least 15% going forward, like we did during the Great Recession, to stimulate the economy and to offer protection to families that are experiencing food insecurity.
Well, I can't tell you all how much I appreciate your time, your insights, your thoughtfulness, and the relevance of your comments to the current policy environment, particularly in the context of food insecurity, and also in the context of whether we have a long run or a short run supply distribution problem. Thank you so much, everyone, and thank you to the audience for listening to us. We so appreciate your tuning in. Please don't hesitate to tune in to other great American Enterprise Institute panel events. This was so much, this was so interesting, guys. Thank you so much. Have a great afternoon, or in my case, morning.
Thanks, Vincent.
Same to you, Vince. Thanks, everybody.
Thanks, Vince.
Thank you.
Oh, you're welcome.
Thanks, everyone.
Thank you.